Perfect.
Okay, so I really like to talk, so I'm going to do my very best to stay within the time. I'm really grateful to be here. I'm really grateful to Megan and IHAPS for their support. And I should say that this support comes from my work as chair of the Houston Women's Commission and our work to create policy that I think fits particularly with the social sustainability model, thinking about wellness and overall social health. Oh, there we go. Okay, so the Houston Women's Commission was established in August of last year, and our initial charge from Mayor Sylvester Turner, who established it after a vote by City Council, was to address the disparities that the COVID-19 pandemic has exacerbated for women in the region in areas including job loss, healthcare and leave coverage, childcare needs, and wage disparities. My background, so I was appointed by Mayor Turner as chair of the commission. And I would say my sort of relevant background here is one, that I'm a mother of 2 young children, and of course, a woman with her own career, and also that I was author of our acute family care leave policy at UHCL and had really sort of dug into FMLA and policy around paid parental leave, and also sort of alternatives to that policy, and sort of had become accustomed to working within conflicting policy between, for example, the state and what might be possible federally or sort of within the city. So I want to just give you a kind of quick introduction to the commission and what we're working on. We have 5 subcommittees. They are healthcare, career access, wage equity, family life, and city employment policy. And these are each made up of about 5 committee members, and each have their own subcommittee chair. And I'm not going to go over all of them, but I thought I'd give you just some examples of what a couple of the subcommittees are doing to give you a sense of really the incredible kind of expertise that was assembled for this commission. And I can say that unabashedly because I did not choose the folks. People smarter than I am chose the folks. And also the sort of depth of issues in Houston affecting women and their families. And the range of issues that we're looking at. So for example, our healthcare subcommittee is particularly interested in solving this problem. How do we bring healthcare and healthcare information out of clinics? That is, what we know is that folks who are already able to access clinical settings have access to a certain level of healthcare that many people don't, just because they don't have access to those settings, whether because of a lack of insurance or a lack of time to visit the clinics or a lack of sort of overall access or agency. And a solution that healthcare subcommittee is working on is the creation of a public health information network that they hope will also allow them to actually bring healthcare into communities directly. And one of the ways they're looking at doing this is actually using daycare and childcare centers as sites of health communication. And we're thinking, of course, about the need to communicate health information to women of reproductive age, but also about the fact that women of reproductive age generally make a lot of the health decisions for their entire families, right? The research shows us they make decisions for their children. They often make decisions for their spouses, or at least have influence on their spouses, and then also their parents. Our wage equity committee is looking at a major problem in Houston. So many of you have probably seen the statistic before that nationally in 2020, women made 82 cents for every dollar earned by a man. That national number is already jarring. And I realize this chart might look sort of small, but if we look at that number in Houston, we actually see a much more disastrous sort of landscape here. So one thing that's really important to do is to divide these populations by race and ethnicity, because simply those round numbers, $1.82, actually don't tell us as much as these numbers do. So if you'll look at these numbers, you can see that in 2019, and this is in Harris County, for every dollar earned by a white man, a white woman earned 70 cents to the dollar. So that already speaks to a wage gap much broader than the national one. But then once we start to look at women of other ethnicities or races, we see something even more disturbing. So for example, Asian or Pacific Islander women earned 63 cents to that dollar. Black women earned 45 cents to that dollar. And of course, this uses government terms. So Hispanic women earned only 38 cents to the dollar earned by a white man in Harris County. And so wage equity is really one of our biggest battles, and also one of the most complicated things to solve, because in Houston, it appears that much of our disparity comes from the kind of industries that our economy is based on. And I'm thinking here about oil and gas, about energy more broadly, and also about medicine, and the sorts of gender and race disparities that occur in those industries. So I don't have a solution to this problem for you in this 6-minute presentation, but that gives you a sense of sort of the source of things that committee is taking on. Another committee is our City Employment Policy Committee. And this is a committee where we've actually been able to make some really substantial movement, which is what I want to talk to you about. The initial challenge from Mayor Turner when our commission was established was to create a proposal for paid parental leave. We pushed a little bit further than that, and in cooperation with City HR, Legal, and Finance, we proposed 2 ordinances in March 2022 that were both signed into law by Mayor Turner just last week on April 13th. Those 2 policies are, one is a paid parental leave policy, which you see right there. The other is a paid prenatal and infant wellness leave policy. So the way that a paid prenatal and infant wellness leave policy works, as we wrote it, was that it provides a bank of time, which is separate from federally mandated leave for pregnant employees. The bank is attached to any single pregnancy, and it can be used during that pregnancy and with 1 year after the end of the pregnancy. And this is really important because something you don't see reported. This sort of wasn't reported that broadly in the news, I think, because the significance was perhaps lost on many people, but I myself was someone who experienced a miscarriage between 2 successful pregnancies that resulted in my daughters. Of course, I had no recourse, right? So the fact that this is attached to any single pregnancy is really important, because it doesn't mean that your pregnancy has to result in the live birth of a child. It doesn't mean that you have to keep that child. And frankly, it could mean that you've terminated a pregnancy, but you still had a need for medical care or for time off during that pregnancy, if, for example, you were very sick or you needed time to make decisions about your pregnancy. So this is actually a really progressive policy in that way, and it's rare. This is a place in which the city of Houston is leading. Our closest competitors, like Harris County, offer paid parental leave. They don't offer this leave. One of the other factors that made us so supportive of this policy has to do with maternal mortality rates in Texas. Which you may know the United States has extremely high maternal mortality rates, higher than any other of our peer nations. And Texas has higher than average rates within the United States. And one major factor in reducing maternal mortality rates is access to care, including regular appointments with a primary care provider and preferably an OBGYN. And that person can assess risk, they can look for complications, they can refer patients to specialists, including mental health care providers. For a non-complicated pregnancy, the minimum number of physician visits recommended is 12 to 14. And then, of course, a person who has given birth should see their physician at least 2 times within 60 days of that birth as well. Babies should see a pediatrician at least 8 years during the first year of their life. And so one of the really exciting things about this policy is that it encourages, I would say, City of Houston employees to take time for all of these visits, right? And in other words, the city is investing in the health of its employees. And this is particularly important given what maternal mortality looks like. The newest data during the pandemic, there was an expected increase in maternal mortality rates. That happened, but the increase was much sharper than many thought it would be. A 14% increase in overall maternal mortality rates in the United States. There are major equity issues here, as you can see. 1/3 of women who died during and just after pregnancy in 2020 were Black women, although Black Americans make up just 13% of the US population. The numbers there mean that Black women are 3 times more likely to die during or just after pregnancy than white women are. And then historically, maternal mortality rates for Hispanic women had actually been much lower than those for white women, but during 2020, their number rose to be equal to that of white women. And so this is an overall health problem. It's an equity problem. Paid parental leave is our second policy. It offers 12 weeks of fully paid leave for any city employee who has worked for the city for 6 months or more. It runs concurrently with leave as designated by the federally with federally mandated leave. And actually, interestingly, it has minimal financial impact on the city. And this is because it's extremely rare for the city to hire a temp to stand in for someone during a period of federally mandated leave, because the cost of training a temp and really the sort of strain on employees of getting a temp up to speed is such that the city has already planned to pay people for 12 months. And if someone takes that leave unpaid, that money has already been designated. If they take that leave paid, there's no additional expense. There's no need to hire anyone new. And so this is a case where this is really good financial policy and really good social policy. The benefits of paid parental leave, it allows families to bond and rest. There's a direct correlation to reduced infant deaths, a lasting impact on children's health, perhaps due to things like increased breastfeeding rates. We see fewer childhood hospitalizations, increased parental involvement, and then really importantly, a lower incidence of postpartum depression among new parents. We also see, and this is sort of the economic side of this, right? We see improved ability of the employer to attract and retain talented employees and a boosted labor force participation. And that's particularly important because of what we call the Great Resignation, which has particularly impacted women in the United States over the course of this pandemic. Women account for 70% of the job losses of the past 2 years, with over 1.1 million women who left the workforce entirely during the COVID-19 pandemic. One of the major reasons has to do with caregiving responsibilities, particularly childcare. As childcare became more expensive and more difficult to access during the pandemic, it was women rather than men who left the workforce. And it was only in March of this year that we actually started to see women return to the workforce at all. So whenever you saw an increase in 2022 in total jobs in the United States, right? Whenever we talked about the economy adding jobs, those actually until March were entirely, those jobs were entirely occupied by men, and no statistically significant number of women were taking on those jobs. And then of course here there is an equity issue as well. Women of color were hit particularly hard by this exodus from the workforce. We also have rising healthcare costs. You all know we're dealing with inflation. In 2019, the average out-of-pocket cost of childbirth in the US was about $4,500 for someone with insurance. Additional complications or diagnoses only increase that burden. So unpaid parental leave actually has a doubly difficult financial consequence because you both have high medical bills and you have a loss of wages. I'm almost done. This is our next step. So our next steps on the commission are to try and extend these benefits so that they are provided by private employers as well, particularly those who hire our city contractors, the folks who keep City Hall clean, who keep it safe, the security at the airport, right? All of the people who don't have the benefit of full-time city employment, but are contractors. We're doing that through a citywide challenge. And then looking ahead, what we would really love is to one day find a sustainable way to offer caregiver leave so that we're not just thinking about folks who are parents, but we're thinking about the range of caregiving responsibilities that people who are city employees in particular take on. Okay,